Welcome back. The ban on the sale of alcohol in South Africa remains controversial. Doctors and health workers have welcomed the ban, saying it's freed up critical bed space in hospitals as the country battles the COVID-19 second wave. But restaurants and those directly involved in the liquor business say they're losing their livelihoods. The Liquor Brand Owners Association says the alcohol ban has fueled illegal alcohol supply channels and contributes to the sale of illicit liquor. To discuss, we're joined by the Chairperson of the South African Liquor Brand Owners Association, of SALBA, that's Sibani Mngadi. Mr. Mngadi, thank you for being with us. Can you outline your concerns?
Well, the concern here, Francis, is once you stop the formal side of the business of our industry, immediately what we have seen over the past 3 bans is that then you immediately have illegal traders coming through to close that gap. Particularly in this case, when President closed the trade on the 28th, 2 days after, on the 30th, one of our members' manufacturing plant in Durban was subjected to an armed robbery, and all that was stolen in that instance were the bottle caps or closures. What we understand that to be is it supplies the syndicates that kind of take the used bottles of branded bottles of alcohol, particularly spirit. They refill it with illegal alcohol and resell it to the public as a genuine product, which then poses a serious health risk to the people of our country.
So you're saying if you're buying alcohol on the sort of black market right now, you could be buying something that is very poisonous to you?
Yes, there are many categories of this. There is, of course, the counterfeit product that I've mentioned, where they refill use branded bottle. Of course, there will be circulation also of genuine products, many of which were intended for export. So we will sell products for duty-free and other export purposes, and those products do not leave the country. Other products are imported illegally, crossing the border into South Africa illegally. And all of those, although the liquid itself might be genuine, but in reality they haven't paid taxes in South Africa, and they have been managed illegally across there. So we would like to appeal to the public not actually to purchase anything at this point until the government allows for the sale of it.
Is the argument the same as those who objected to the cigarette ban, that these people using these alternative means crossing borders with alcohol could get stronger, strengthen their supply chains, things like that, and they could remain strong even when alcohol is unbanned? Or is that not a problem for the liquor industry?
It is a big concern, Francis, and even we appreciate that even the Commissioner of SARS has acknowledged that the type of logistics that are building up in the alcohol as well as tobacco sector, it will take many years to dismantle. What we have seen is really high volumes circulating in the country. What is worse with this current lockdown, because many of people would have anticipated that there was a possibility of a ban on sales. They did purchase their products and stockpile to a certain extent. As a result, you see that the prices currently that are circulating illegally are relatively lower than what they were during the second and the first lockdown, which then suggests that you have a network of people who really can move around illegal products. At the end, it's a loss for everyone. It's a loss for government, which we estimate they lose around about 6.4 billion in unpaid taxes as a result of these products. And also on our side, it's around about 7 billion on the lost revenue as a result of this illegal.
Is this really an argument to open up alcohol sales? If the supply chains were huge, you'd still have all those trauma-related cases in hospitals. The doctors wouldn't be saying it's incredible, the decrease in trauma and things like that due to alcohol. So is it really an argument to open up? Are you pushing that argument?
Yes, we do feel, if this problem can be solved in a simple way, if we allow sale of alcohol for home consumption, because we do not see any risk associated with that. Firstly, the infections or the risk of infection in a grocery store is no greater than the risk of a visit to a local grocery shop. So that experience on its own doesn't expose you to possibility of infection any greater. As well
I'm talking about the trauma-related cases in hospitals. The whole rationale here was to free up beds, and seemingly that has been achieved.
We do know, well, we have looked at the South African situation and compared it to the countries that implemented the restrictions on movement. That is the curfews, the banning of gatherings. A number of them in Europe, UK, US have implemented those measures. Those countries did not ban alcohol sale for home consumption, and those countries have achieved more or less the same number of decrease in the admission to emergency ward. We do feel that the attribution of all the outcomes to alcohol is really not an ingenious approach, because every time we've had alcohol ban in this country, it has been running parallel to the extended curfew in terms of maximum hours. And every time we have had the lift in the ban of sales of alcohol, we have also have a reduction in the number of hours for curfew. And we do feel that if we are to retain the curfew, retain the ban on gatherings, but open the box store and purchase for home consumption, that in that instance we will be able to have people consuming at home, consuming genuine products instead of buying illegally and incriminating themselves to a certain extent.
All right, finally, has anyone died from drinking? We hear about these sort of home brews, concoctions mixed behind closed doors.
Yeah, we have had reports, I think, in the Free State, in Bloemfontein, of incidents of death. I think 3 people affected there. And in the previous lockdowns, we have had, I think, in the Eastern Cape as well, deaths as a result of consumption of those concoctions. And Contralesa has issued a statement which we really appreciate, calling on people not to produce for themselves alcohol. We have had, I think, in the Northern Cape, in the Kimberley area, a person who passed away as a result of consuming illegal alcohol. It is a problem. I don't think people should be consuming anything that has been produced with no level of health and safety in the production process. It can expose you to anything. It can be death, yes, but it can lead you to various diseases that can affect one in the long term.
All right, thank you very much, Sibani Mngadi, Chairperson of the South African Liquor Brand Owners Association.